Hi everyone, we are from NST ICU at La Jolla, and for one of our videos we are going to talk about the use of the pupillometer. You will typically find your pupillometer on a charger like this, and on our unit we have a sheet for you to write the room number you are taking the pupillometer to in order to keep track of its location. In your patient's room, you want to make sure they also have their own smart guard to attach to the pupillometer like so. After attaching the smart guard, it will prompt you to either use a barcode scanner to scan the patient ID or enter the ID manually. Now, for learning purposes, we will enter a fake ID manually. Once you click enter, it will have you do a second check to ensure you have the correct patient on the screen, and once you verify, it will say ready to scan. Once your pupillometer is ready to use, you can use the foam part on the smart guard to place directly onto your patient's cheek and have the pupillometer point directly at the patient's eye. Now, while looking at the screen side, you can hold down the right button for the patient's right eye and make sure there is a circle over the pupil. Let go of the right button and it will apply light to the eye, analyze the pupil, and show you this first screen. Before diving into what these numbers mean, I want to emphasize the importance of having a baseline reading for high-risk patients on the pupillometer from when they're first admitted to the unit. Now, the first screen looks at two different things: NPI, or the Neurological Pupil Index, which shows pupil reactivity. This is the main number we pay attention to. A normal or brisk number is anything from 3.0 to 4.9. Less than 3.0 is abnormal or sluggish. If it is 0, the pupil is deemed non-reactive. Now, the pupillometer may also prompt you to do an additional reading if the NPI is 0. Also, if there is a difference between NPI, between the right and left pupils, of greater than or equal to 0.7, this may also be considered an abnormal pupil reading. The other row is showing the maximum pupil size in millimeters before constriction. After reviewing these numbers, you can hit the right button and it will go to the second screen. The first two rows are the same from the previous screen, but it dives deeper and has a lot more results. The first one is min, which is the minimum diameter in millimeters, or the pupil diameter at peak constriction. Now, for both the minimum and maximum size, the low to high range in millimeters is 1.0 to 10.0. CH is the percent of change from the maximum diameter to the minimum diameter. The low to high range for CH is from 0% to 50%. Then there is CV, or constriction velocity. Now, this is the average of how fast the pupil diameter is constricting, measured in millimeters per second. The low to high range for this is 0 to 6. Then there's MCV, or maximum constriction velocity, which is the maximum speed of pupil constriction responding to the flash of light, which is also measured in millimeters per second and has the same range constriction velocity has of 0 to 6. Then there's LAT, or latency of constriction, which is the start time in seconds of constriction following initiation of the light stimulus. Normal range for this is 0.0 seconds to 0.5 seconds. Lastly, DV, or dilation velocity, which is the average pupillary speed when, after having reached peak constriction, the pupil tends to recover and dilate back to resting size. The range is measured in millimeters per second as well, and is also 0.0 to 6.0. Now, be sure to accurately chart these results in Epic under the pupillometer section to continue to trend the results from this test. Once you're done using your pupillometer, you will want to remove their safeguard off their pupillometer. It's also helpful to keep a patient label on the safeguard to keep track of their own right in that area. In order to remove the safeguard, you will squeeze the sides and pull away from the pupillometer. Once you're done using the pupillometer, be sure to return it to the charger.